he was taken to interventional radiology for placement of a vertebral artery stent. We want to get the blood flow going back through this artery. We want to stop any clots from breaking off. So we put a wire mesh fed through his artery right here. Then we inflate a balloon, expand the mesh, and that allows the blood flow to resume back through here. And it also prevents any clots from breaking off here. So the patient tolerated the procedure very well until the next morning. He was found to be unresponsive. He had a fixed dilated pupil, a so-called blown pupil. And right hemiplegia, which is the right side of his body, was completely paralyzed. We've got a CT of his head. CT scan basically takes sections of the head going this way, and you look at it going down. So this is a cross-section of his brain, and this is all blood right here. This is a severe hemorrhage. There's not enough room in his head for both the blood and his brain, so all these structures right here are being compressed. This patient's very near death. If he hadn't been in the hospital when this happened, he would have died. So the treatment for this is to go straight to the operating room, get neurosurgery involved, drill into his skull and drain all that fluid out just to relieve all this pressure in here. So what went wrong? What happened with this patient? Well, he had something that's known as hyperperfusion syndrome. And to show what that is, for these 3 weeks he wasn't getting the blood flow to the back of his brain that he needed. And the artery can actually compensate for that. It can expand like this and allow more blood to flow through there. So it's getting a weak stream, so it switches to a larger hose. When we put the stent in, suddenly the fire hose got turned on full blast. And so the blood started shooting downstream. His artery couldn't compensate for that. And one of the arteries in his brain ruptured and caused all the bleeding into his brain and all these symptoms. So how do we look at this? Well, let's review. We had 2 rare complications following 2 procedures. The first was manipulation of the neck causing vertebral dissection, eventually causing a stroke. The second was the placement of the stent that caused hyperperfusion syndrome and almost killed him. So if we were on the outside looking in, or if we were a chiropractor looking at this case, how would we see it? Well, we'd see the ischemic stroke following chiropractic manipulation is very rare. It hasn't been extensively studied, but the studies that are done say it's 1 in a million, 1 in 40,000 at best. Whereas with hyperperfusion syndrome, it's rare, but it's not that rare. A lot of people that get these stents placed, about 1 in 100 will get hyperperfusion syndrome. 1 in 1,000 will actually get the mass effect where the blood compresses all the structures in the brain. This one over here, a chiropractor would say, well, he just had these benign symptoms, just some headaches, numbness. It wasn't that big a deal. We went to we sent him to the hospital, and we tried to kill him. He has these permanent symptoms, this paralysis, and a chiropractor would also say there's no proven causal link between the manipulation and the dissection, because we don't get CTs on people when they're healthy. So we can't prove that he didn't have this dissection already when he went to the chiropractor. So, but on the other hand, this hyperperfusion syndrome is a known complication of a very risky procedure. Why would we even do the procedure if we know this is going to happen, or know this is a possibility? Well, in medicine's defense, because this complication over here is denied by the chiropractic community, the patients aren't prepared for it. They don't have the consent they need to have the procedure done. Whereas with this patient, we spent a half hour talking to him about this is everything that can go wrong with placing a stent. This is a known syndrome. We can cause a stroke. We can cause death. Very rare, but you need to know that these can happen. And most importantly, this is an unnecessary procedure, the chiropractic manipulation. I won't say chiropractic isn't effective, but it's kind of like me cleaning my fingernails with a razor blade. It'll clean my fingernails, but there are a lot safer ways to do it. Whereas over here, having a stent placed was a very necessary procedure to prevent future strokes down the line. As one of my surgery attendings said to me, I can teach a monkey to do an operation in 5 years. The reason you go to 4 years of medical school and 5 years of residency is to figure out when to operate. We don't take the appendix out on everyone because we'll kill 1 in 1,000 people that have their appendix out. So we, over here, because we acknowledge that this is a complication, we've studied it, we've researched it, we know how to prevent it, how to treat it, what patients are most likely to get this. And we know what patients aren't candidates for the procedure. Whereas over here, anyone that walks into a chiropractor's office is going to have their neck manipulated. And I'm not saying that chiropractic should be outlawed, that it shouldn't be done, but it should be a last resort, or it should be used in conjunction with other physical therapy methods, like the ultrasound or massage or stretching exercises. It shouldn't be the first line of treatment, and it definitely shouldn't be used in treating cancer, diabetes, asthma, anything that's not acute neck and lower back pain. So just going back to our patient, following his procedure, he spent 2 weeks in the intensive care unit. While he was there, he developed a severe case of pneumonia and almost died from that too. He stayed in the hospital for about 3 months, mostly in rehab. This is about 2 years ago, and he still has severe disability. He's literally just taking his first steps on the road to recovery, and he's now able to take care of himself independently. And all this stemmed from this unnecessary procedure, so we believe. It all started from this chiropractic manipulation. So I just wanted to show one other thing really quickly.
We were bored in court yesterday.